Good afternoon everyone and thanks for joining us today. My name is Aisling and I'm the Health and Research Information Manager at the Children's Liver Disease Foundation, which is also known as CLDF. I'm here with my colleague Lindsay Hogg, our lead nurse at CLDF, who will introduce herself properly in a moment. And we're here today to talk to you about paediatric liver disease. We'll give you a brief overview of the liver and what can go wrong to cause liver disease in children and young people. We'll then talk about the diagnosis of liver disease in newborns, the key signs and symptoms to look out for, and the importance of early diagnosis. We'll talk about CLDF's Yellow Alert campaign, which promotes the early diagnosis of liver disease in newborns, and we'll provide you with information about free, helpful resources you can access to find out more and to share with your teams. Finally, at the end, we'll let you know a little bit more about Children's Liver Disease Foundation, the charity, and how we can support you as healthcare professionals, as well as your patients and families who are affected by childhood liver disease. And now I will hand you over to Lindsay.
Thank you, Aisling. My name is Lindsay, as Aisling said. I'm a Principal Specialist Nurse at Birmingham Children's Hospital, working in the liver unit there, looking after children and families that have liver disease and children and families that are affected if the children go on to have liver transplants. We also look after children with intestinal transplants. We're the only place in the UK carrying out paediatric liver and kidney transplants as well, in partnership with the renal team at Birmingham Children's Hospital. And I help and support Children's Liver Disease Foundation at their varying events throughout the year, and contribute into updating their extensive leaflet collection as well. My aim today, as Aisling said, is to just try and give you a sort of basic overview, a bit of background information about the liver and some of the conditions, the paediatric conditions that affect the liver. Some of the nurses out there will remember little bits back from your liver training, but hopefully I'll give you a little bit more and sort of refresh your memory, probably more than anything else. So the liver is located in the upper right quadrant of the abdomen, just below the diaphragm. It is described in lots of literature as the powerhouse or the factory within the body. It's the body's largest solid organ, and it's made up of about 100 billion cells. It has over 500 functions. But when we're speaking to the families, and a lot of the information I'll give you today, I'll talk about how we give information to families, because part of my role, or biggest part of my role, is informing the families about their liver and why we're doing what we do, why we do some of the investigations, and what it means as well, and going through the results. But the first time we meet the families, or certainly in those first few days or that first clinic appointment, it's establishing what they know about the liver. So the liver functions that we go through with them. The liver makes bile. Bile is a chemical or a liquid that is made in the liver. It's drained from the liver via the bile ducts, little small tubes, and then it's collected in the gallbladder or stored in the gallbladder. And then when you eat a meal, if it's a particularly fatty meal, the gallbladder will contract and the bile will come into the first part of the intestine and start the process of digesting fat within the body. The liver is hugely involved in how we digest and metabolize our food. It's one of our sort of major functions of the liver. One of its major functions is to metabolize sugar, and sugar comes in as glucose. The liver is able to process it into glycogen, and then it's back into glucose and released into the body when you need that energy and when you need that glucose. It also, as it says later in this, stores iron, vitamins and other essential chemicals within the body. It has a role in infection prevention. It detoxifies things, it breaks things down into the body so that they can be excreted through the kidneys. It produces hormones and regulates some of your hormones, and it metabolizes a lot of drugs that you take into your body, or chemicals that come into your body, not just drugs. So it detoxifies alcohol. Everybody knows about alcohol in the liver, and it's one of the first things when you say that you work in paediatric liver disease, most people will say to you, I didn't know that children got alcoholic liver disease, because a lot of people, that's their understanding of the liver. So the liver does lots and more things than just detoxifying alcohol. It detoxifies all of the chemicals and drugs that come into your body. One of the other functions of the liver, which isn't on our list today, is that it makes your clotting factors. So to allow your blood to clot in injury, your clotting factors are all made within your liver as well, and heavily involved in that. There's a huge numbers of paediatric liver disease, and authors have suggested that there's over 100 paediatric liver diseases. We certainly see a huge variety within our unit in Birmingham and across paediatric liver disease in the UK. There are 3 centres looking after children with liver disease: King's College Hospital in London, Leeds, and ourselves in Birmingham. And we see, as I say, a variety of conditions, and lots of different conditions. There's conditions that affect the cholestatic liver diseases, so liver diseases that don't allow the bile to flow out from the normal way that it should through the bile ducts into the gallbladder and into the intestine. A condition called biliary atresia, and I will mention biliary atresia a little bit more later on. Another cholestatic liver disease would be choledochal cyst, which again it impedes the bile draining out of the liver. Alagille syndrome is another one that impedes the bile draining out and can be diagnosed in infant, as a baby within the first 6 months, or it can be diagnosed later on, but it affects how the bile drains out. Obviously, infection within the liver, hepatitis A, B and C. We don't see so much hepatitis A, but we certainly look after children that have hepatitis B and hepatitis C. And treatment options are expanding for these children all the time. There's a lot of research going into treatment options for hepatitis B and C, and we look after that. We have a specific team within our liver unit that does that. Other infections that can affect the liver is CMV, cytomegalovirus, or Epstein-Barr virus, the virus that causes glandular fever. There are children that can have quite a nasty inflammation of the liver due to EBV. Herpes is another one that we've seen, that children have developed herpes within their liver, and that can be quite tricky to treat. Metabolic diseases, alpha-1 antitrypsin. Alpha-1 antitrypsin disorder is a rare inherited condition. It affects about 1 in 3,000, 1 in 4,000 children in the UK, and it is a sort of the second most common inherited condition next to cystic fibrosis within the UK. Alpha-1 antitrypsin can be diagnosed in childhood, but can also be diagnosed as adults, and it can affect your lungs. So the British Lung Foundation has a lot of information about alpha-1 antitrypsin, and our families receive support and information from there as well. Galactosemia, tyrosinemia, both metabolic conditions looked after in conjunction with the liver team and metabolic teams. And then immune diseases. Autoimmune liver disease is one of the most common liver diseases that affect children or young people, autoimmune is more likely to be diagnosed in teenagers or sort of young adults, but we see a lot of young people that come into us around about 13, 14 that are diagnosed with autoimmune liver disease, and they are treated by giving immunosuppression. The other sort of liver disease that will become more common over the next few years, and looks like will be our biggest challenge, is a condition called non-alcoholic fatty liver disease. The government commissioned some nice guidelines, and they were published back in July 2016. Some authors are suggesting that by 2020, non-alcoholic fatty liver disease may become the leading cause of end-stage liver disease, and could potentially lead to people needing liver transplants. Now, we know that obesity levels are rising in the UK. Only last week there was a report that was released, and that 40% of children, between 30 and 40% of children are now obese once they're sort of getting into secondary school. So we know that non-alcoholic fatty liver disease will become more of an issue and something that we need to manage. We know that not all obese people will develop non-alcoholic fatty liver disease, and we know the risk factors for people with diabetes type 2 and other metabolic diseases, so we're getting better at screening and looking for that. I know that some of the people that might be watching this could be, I know there's some health visitors and some community nurses and school nurses, and one of the things that we thought about was how would you know, or how might you recognise liver disease in children and young people that you're looking after. There's a whole variety of things that you may see in children. One of the things, the sort of most common, could be that the children develop jaundice and their skin becomes yellow in the whites of their eyes. We'll talk a little bit more about jaundice as we go through. The other things that you might see is that they're tired, decreasing energy, poor weight gain, and in the extreme cases may vomit blood. And certainly if that was the case, then they need to be referred quite quickly and seen to have sort of liver disease almost excluded from these things. Also, frequent nosebleeds is another one that we've seen when children and young people have been diagnosed. The family have come in and they have sort of reported that they've had an increasing amount of nosebleeds over the last few weeks, and that could mean that the liver's struggling to make the clotting factors to stop that happening. As I said, one of the most common things that you see in liver disease is jaundice. Jaundice is not a liver disease. It's the name given to the yellow appearance of the skin and the whites of the eye. And community healthcare professionals should be aware that there are many causes of jaundice in infants. About 90% of newborn babies will become jaundiced 2 or 3 days after birth. And occasionally they will need treatment for that if the levels of their unconjugated bilirubin levels go up to an extent. They may need a couple of days under what they call phototherapy, special blue lights, or they may be wrapped in a billy blanket to start to bring the bilirubin levels down. That's in general, they call that physiological jaundice, and it's about the rapid breakdown of red blood cells. The 2 to 3 day old baby's liver can be working well, but can be quite immature and take a little while to begin to work properly, and that can just show in bilirubin levels rising and then becoming jaundice. You can be jaundiced caused by liver disease, and you can also be jaundiced by other things or other reasons, including infection. And as it says at the bottom of that slide, it's really important, and Aisling will talk a little bit about that. Prolonged jaundice is jaundice persisting beyond 2 weeks of age in full-term babies and 3 weeks in preterm babies, and we will talk a little bit more about this as we go through the presentation. Yellow Alert is the CLDF's campaign that they launched some time ago about trying to increase awareness about jaundice in newborn babies, and it just raises awareness of the signs and symptoms in liver disease early in the first few weeks of life. As a lot of you are aware, most health visitors will visit a newborn baby around 2 weeks of age. If you do go in to see a family, or you see a family in clinic and the baby is over 2 weeks of age or over 3 weeks if they were premature, it's important that a general assessment of that baby is done. The stool colour needs to be looked at, and the urine colour needs to be looked at. Our families always laugh at us because that's one of our first questions when we first meet them, about what colour is your baby's poo. And in fact, usually when the secretary arranges an appointment for them to come, she will say, can you bring a nappy with them, which always causes great amusement. But it's really important, and why it's important is if the poo is not dark or is in a light colour, so cream, fawn, then it could be that the bilirubin or the bile is not draining from the liver properly into the intestine, and it's the bile or the bilirubin that causes the poo to be brown or have some colour in it. So we become very obsessed in paediatric liver disease about what colour your poo is. And also looking at the urine, asking the families, what colour is the urine? If there's colour in the urine, it could mean that the bilirubin is being excreted through the kidneys, which it shouldn't be. Baby's urine should be clear. And a baby's weight as well, but that doesn't always, but it is a good sort of starting point. We need to know what the baby's weight is and whether they're putting on weight, because children or babies that have liver disease in the first few weeks can be really, really hungry babies, and they feed and feed and feed due to an increased need in energy levels, but they don't put weight on very well. So it's really important that we get sort of a feeding history and what the baby's weight is. If once the child's been assessed that you do find that the stool is in a pale colour and the urine is not colourless, urine has colour, then they need to be referred to a paediatrician, or they need to certainly have a split bilirubin test, and that should be done as soon as possible. How do you spot jaundice? Jaundice in general, you can see jaundice in the whites of their eyes, if you do see jaundice as a healthcare professional, that it's important that that's recorded at that time and that present, because that can be quite important about when the jaundice was actually first seen for the families. If the baby has prolonged jaundice, no matter how mild it is, the stool and urine must be checked, and then the investigation should start. I mentioned there that a split bilirubin test should be done, and the GP can refer for this, or they can be sent up to a paediatrician locally. It depends what your setup locally is. In split bilirubin test, we measure the conjugated bilirubin level and the unconjugated bilirubin level. And in this leaflet that I have here, which is the yellow alert leaflet that CLDF provide for families and for health professionals, the split bilirubin blood test measure the ratios of the conjugated and unconjugated bilirubin levels in the baby's blood. If the conjugated fraction is greater than 20% of the total bilirubin, your baby should be referred to a specialist unit, as this indicates that the cause is a liver disease and needs further investigation. Now, explaining to families conjugated and unconjugated is quite difficult, and this leaflet again can help if you need to do that for a family. Normal baby jaundice, so physiological jaundice that clears within 2 weeks. Normal baby jaundice is caused by a build-up of unconjugated bilirubin. When red blood cells are broken down, unconjugated bilirubin is made, and that's taken to the liver. The liver processes the unconjugated bilirubin by adding a sugar, which changes the bilirubin to conjugated bilirubin. So if you've got high levels of unconjugated bilirubin, that's in general, that's a physiological jaundice. If you've got high levels of conjugated bilirubin, that's more likely to lead to it's a liver disease. We know in paediatric liver disease or paediatric hepatology, the early diagnosis does improve outcomes and it does save lives. I mentioned back at the beginning or in the presentation we talked about a condition called biliary atresia. Biliary atresia is a condition where babies are born without the tubes coming out of their liver, so either the common bile duct or the gallbladder is missing. The common bile duct goes from the liver to the intestine, and if that is missing or malformed, the bile cannot drain out of the liver, and if the bile stays in the liver, it can damage the cells within the liver. And what we need to do with biliary atresia is a procedure called a Kasai procedure, which is surgery. We'd always recommended that the Kasai procedure should be done by 8 weeks of age, sort of 56 days. The latest research and findings that we've done in the UK from the 3 centres that carry out Kasai is that we're more leaning towards that the Kasai should be done at 35 days. So time is a factor, and it's important that infants and children are referred as quickly as possible. If there is any suspicion that there is liver disease, it might not be biliary atresia, but if it is, then we can take forward any treatment as quickly as possible. We know that if the Kasai procedure is done after 8 weeks, then the likelihood is that the child may need to have a liver transplant at some point, or sooner rather than later. I'm now going to hand back to Aisling, who's going to talk a little bit more about the important work that CLDF do around the yellow alert packs.
So, as Lindsay mentioned, whilst liver disease in children is very rare, early diagnosis is essential. So the Children's Liver Disease Foundation has produced a pack called the Yellow Alert Pack in order to help healthcare professionals spot the signs of liver disease in newborns. It's a completely free resource which has been designed with experts in liver disease in children to help you to spot the signs of liver disease in newborns as early as possible. There are a number of different resources which come with the pack. The first one is the Yellow Alert Jaundice Protocol. And the protocol acts as a guide, particularly for health visitors and also for GPs, to recognise jaundice and to know when a baby with jaundice should be referred for further tests. It's been created alongside healthcare professionals, and it's also based on the latest NICE guidance. Many different organisations around the UK use the protocol as a basis for their own jaundice pathways and protocols as well. The second resource within the pack is a stool chart bookmark. As Lindsay mentioned, one of the main signs is looking at the colour of the stool in newborns, and the stool chart bookmark has an array of different colours which provide an objective view of whether the stool is pale or is a normal colour. Health visitors can carry a copy with them in their books and can also order more copies individually, so they can give them out to parents. And any healthy stools will be listed on there, as well as the suspect stools, which should be referred on. The pack also contains a yellow alert poster, which is a little handy poster to try and raise awareness of the signs and symptoms, which can be put up in clinics and in GP practices. And then finally, as Lindsay showed you earlier, we have the Parents Jaundice leaflet, which is also helpful for healthcare professionals who would like to find out more. And this leaflet can be ordered on its own, but also comes within the Yellow Alert pack. And it explains what jaundice is, it goes through the different types of jaundice, and what to do if a baby's jaundice doesn't go away. You can order Yellow Alert packs for any healthcare professionals can order them. They're aimed directly at health visitors and GPs predominantly, as they are the healthcare professionals who will see these babies in the first couple of weeks of their life. But you can also order the resources individually. So if you would like these leaflets to hand out to parents, you can order those. If you'd like to order a number of just the stool charts, you can. And all of the links are at the end of the presentation. So following on from the pack, CLDF have also produced a Yellow Alert app, which was launched in October 2015. And the app has, again, primarily been designed for use by health visitors and GPs. It contains key information on the signs and symptoms of liver disease in newborns, information on jaundice, referrals and tests, and also has an interactive stool chart. So this is the same stool chart that comes within the Yellow Alert pack, but you can click on the individual colours and get a bigger kind of feel for what each colour is. It's a great reminder for health visitors, and it's also a really useful learning tool for student health visitors as well. And it's basically a condensed version of the Yellow Alert pack. So anyone who downloads the app can download the pack directly through the app as well. It was launched, as I said, in October 2015, and it's already had 1,500 downloads, and it's available on Apple and Android devices. So, as I mentioned at the beginning, as well as telling you a bit about paediatric liver disease, we're also here to tell you a little bit more about the Children's Liver Disease Foundation. So here I've kind of split up our work into the four main areas of work that we carry out. So we provide information, that's one of the key areas of our work, with presentations such as this. We provide information for healthcare professionals, but also for children affected by liver disease, young people and their families as well. So this includes medical leaflets and support leaflets, which cover a variety of different topics for patients and their families at different stages through their journey. So when they're first diagnosed, right through later potential transplantation, and more general support information, so going to university with liver disease, starting school with liver disease, all that sort of stuff. We also provide support to patients and families, and this is a really big area of our work. We have a young people's team and a families team within our support services, and they can provide one-to-one support with families and young people. They can answer individual queries and work with people individually, and also facilitate peer-to-peer support. So we've got a wide variety of tools that we use. We've got a social media site called Hive, which is just one example of facilitating that peer-to-peer support for young people between the ages of 11 and 25. But we also hold family events around the UK as well, which is for anyone affected by liver disease under the age of 25. So families can come together, young people can come together, meet other people in the same situation, and make bonds. If any of your patients are diagnosed with liver disease at any point, you can refer them on to us. They can either get in touch themselves, or you can contact our support team, who will then contact the families. We also act as a voice for children and young people affected by liver disease and their families, which involves collecting in the views and opinions of our supporters, and then representing them at a variety of different forums. This includes NICE guidelines, and also influences our campaign to increase the rates of organ donation. The UK has one of the lowest rates in Europe for families supporting organ donation. So we recently came together with 15 other charities to launch the Donation Conversation campaign, which focuses on encouraging the public to let their loved ones know about their wishes for organ donation. And finally, research. We are a medical research charity as well. We fund vital research into understanding paediatric liver diseases and fund research aimed at treating and curing childhood liver disease, as well as research looking into living with liver disease as well. We also connect researchers with our supporters who are keen to contribute to research and make sure that their voices are heard and that patient representatives can be involved in research studies. And finally, this is the last slide now. Here are some of the additional resources and some links to where you can find them. Most things can be downloaded from the website, and there's also an order form on there where you can order any leaflets. If you can order a yellow alert pack, and you can also order the different elements of the yellow alert pack individually as well. So thank you very much for listening. If you ever require further guidance, or if you ever get patients who are affected by liver disease and you'd like to find out more or refer your families on to us, then please do get in touch. Thank you.